Alicia. I'm here interviewing today for Desi Girl magazine. Today's guest is Dr. Siri She's an emergency medicine physician in New York City. And we've asked her to tell us a little bit about her journey and provide us with information on how to continue to take care of ourselves during the ongoing pandemic. So I'm just going to connect to her real quick.
Hey,
Hi, how are you?
good. How are you?
Good. It's nice to meet you. Thanks for joining.
Oh, it's so nice to meet you. Thank you so much for having me. How are you?
Yes, I'm good. We wanted you to tell us a little bit about yourself, Siri. Where did you grow up and what inspired you to go into medicine, specifically emergency medicine?
Hi, everyone. For everyone joining who I don't know, my name is Dr. Siri. I am an emergency medicine doctor in New York City. I was born in India, but I kind of grew up all over the United States. I grew up until middle school on the East Coast in Jersey, and then on the West Coast for college, and came back to the East Coast for medical school and training.
Okay,
hmm
nice. And during this time of COVID, how has your medical experience changed in the hospital that you work at?
It's been crazy, obviously.
Right.
Um, as you see in the news, it's unlike anything that you've ever experienced in the past.
Yeah.
So basically, I think COVID has really changed our opinion about what healthcare professionals are kind of meant to or meant to society. I think it's really given them value. Prior to the pandemic, a lot of people, I feel um, just took them for granted. And then during the pandemic, we're the only ones who could go to work. It was basically like an apocalypse, and we were like the warriors fighting the apocalypse.
Yeah.
Um, so I think one of the things, I know you asked me what motivated me to go to medicine. I really wanted to pursue something that I felt like I wouldn't just see myself doing for a year or so. Just in medicine, you can always expand and do anything. You can do consulting, you can do all these other kinds of things. So it's you always journalism if you're interested, you can do
Yeah.
advocacy. So it's great.
Yeah, that's good. What do you love most about what you do?
um I think what's, I don't know, the coolest part is it's so flexible,
Yeah.
and you really make a difference in people's lives. Like you have no idea your impact on other people, even if you don't do anything big. You basically are able to really change their perspective on different things, um their own health, or if someone comes in I don't know, we've had cases during the pandemic where people who were in relationships, only one person came in, and then the other person was mourning because that one person might have passed away or whatever. So it's I think you really get a chance to change people's perspectives.
Of
I
course.
don't know.
Yeah.
Yeah.
And what are some tips of self-care physically and mentally that you can suggest for others, especially during the pandemic going on?
I think that's a really good question. Obviously, we all need to make sure we take care of ourselves, because if we can't take care of ourselves, we can't take care of anyone else.
Yeah.
And I think one thing that's important to me personally is I need to make sure that I have enough time to eat, breathe, and sleep.
Yeah.
And some people don't, I'm telling you, people don't make time for that.
Yeah.
Especially in medical training and stuff. I've interacted with some residents who are this is my first meal of the day in 24 hours, and I'm
Yeah.
why is it this way? It shouldn't be this way. We should
Yeah.
all have the opportunity to kind of actually even have that time. And in order to make that time, um, you just need to make sure that every week you would just say this is my day to de-stress. Every week I have one. Even growing up, in high school or whatever, like on Saturday I don't do homework, or whatever.
Right.
I
Right.
make that my no homework day, and I just
Yeah.
live my life. So I think that's the most important part. And I don't know if other people work that way. Some people like shorter breaks, some people like longer breaks. For me, like I need to like take longer breaks because I think that that's just more useful.
Yeah, same here. I see what you're saying.
Yeah.
And with emergency medicine, like what advice do you have for anyone who's looking to go into that field particularly?
So one of the reasons that I decided to like start my page and like um kind of be more public about being an EM doctor is because you don't see a lot of representation from women, and you also don't see a lot of representation from people who are like minorities in emergency medicine. When you think of like an EM doctor, you still think of like the big white dude who like is fit and like will go like a cowboy into any situation.
Yeah.
You don't think of like a petite Indian girl who's like screaming at the top of her lungs, compressions, you know. So I think like I that's why I do give a lot of advice on in terms of like emergency medicine on my page already, but I think like one of the most important things I think people should realize it's not the same as other fields of medicine. Like internal medicine is very regimented. You'll know your schedule like week on, week off, or certain other things like office-based practices. You'll know like it's 9 to 5, it's 9 to 6. Or emergency medicine, you work all hours of the day, all days of the week,
Yeah.
all weeks of the year. So
Right.
you are literally like living like, and this is how I think about it, is like you're living like you're in college for the rest of your life. If that's something you enjoy, then that's like cool. Cause I like go on a kind of like oh, I have my schedule for 3 months. Okay, this is what I know I'm gonna do for 3 months. And then those 3 months after, it's like, oh, okay, like, oh, which schedule did I get, or what weekends am I off? Or and one other thing is we work a lot of weekends, and we work a lot of time during the holidays because
Okay.
we service those days. No primary care physician is going to be open on like New Year's Day at like,
Yeah.
6 in the morning, like, hey, come,
Yeah.
like, we'll see you. It's going to
Yeah.
be us taking care of like all those issues. So I think like really the advice is that learn to like love every part of kind of medicine, and you have to be good at so many fields, and you get the best 5 minutes of each field. So I get the best 5 minutes of cardiology. Like a patient is like suffering a heart attack, I get to be like in the best 5 minutes where I diagnose like, okay, I think they're having a heart attack, and then the cardiologist takes care of the rest. But I get that excitement, and I think
Yeah.
like that's the kind of excitement that you get like from whatever the field is, like giving a like having a patient give birth. Like if they come in like kind of already like with the baby sort of out, you just
Right.
deliver it in the ED, and then you don't really take care of it after. That's the people after, but you get
Right.
to get that excitement too. So I think like if you're into that, then that's something. We don't get a lot of longevity at all. Like I never want to see a patient twice. Like I'm like, hey, listen, if I see you again, I don't think that that's really something that we really want to do. So I think like there's very like high highs, and then there's obviously really low lows, like when society is like calling for you and is
Yeah.
like, hey, like you're gonna be working this pandemic.
Yeah.
This is your zombie apocalypse that you've been waiting for.
Okay. Yeah. Because I was gonna say, do you ever get used to it, or is it like is it every day is a new thing for you, or is it like?
I think it's variations of a lot of the same stories, but overall, it's hard to get used to like an exciting kind of variety. Like anything can happen at any time.
Yeah.
Like you never, and I think like listening to the news, like all of that also affects our emergency care. Like for example, if there's a lot of people who listen to the news and they're like, oh my god, like now there's a lot of hesitancy about this vaccine, I deal with it in the ER because now I'm counseling, like, okay, like literally, like let's talk about this.
Right.
So,
Right. You take on
yeah.
a lot of roles. So with that, how do you like maintain a good like work-life balance for yourself?
So like I said, it's like living like you're in college. Some people are very good at like dealing with their own time management, and then some people I think like really like need that regimented structure. for me, I always try to like plan trips, or I like really make sure that medicine doesn't like consume me,
Yeah.
because it's really easy to get lost and tied up in work, and all you're doing is like going to work, coming back, and going to work, coming
Yeah.
back. I always try to like hang out with people that I know, if you know it's safe, obviously.
Right.
um and I think that one thing that's changed in the last year is you really become good at like maintaining relationships that are not only like close to you, but also like very far apart. Like, you know, if you, a lot of people haven't seen their parents for like months, you know,
Right.
and for them, that's not normal.
Yeah.
And like, I feel like as someone who kind of grew up outside the house after I graduated high school, like I didn't really see my parents for like months at a time. So I was like kind of used to it. But I think kind of developing those relationships where people really have the ability to connect with each other, Zoom and all that, is kind of something that like has helped me. Also, I love working out, and I love like kind of exploring New York City. So New York City has so much to offer that it's amazing.
Yeah. And it's opening back up as far as I've heard too. So
Oh, it is. But I think like it should be done cautiously because
definitely.
otherwise, oh, we're just asking for trouble, you know?
Yeah, that's true. And I was going to say, like, with the COVID vaccine now being administered, like you mentioned, like, what are the guidelines? What are some guidelines for the general public you would suggest to ensure safety going forward, like you just mentioned? Um,
Yeah, so that's a really good question. Where are you based in, by the way, if you don't mind
I'm
me
in
asking?
Chicago. Chicago.
You're in
Yeah.
Chicago.
But
Okay,
I
so
was born
that's
and
a,
raised in New Jersey, so I'm familiar with New York City and all that. But I live in
oh, so
Chicago.
you're familiar with the Northeast. So I think like for these cities that are heavily populated, a lot of these CDC guidelines, it's nice if you live in like North Dakota, sure, like walk around with your without your mask on if you're vaccinated, like
Right.
whatever. But I think it's like really difficult for me to like just still be like, okay, I don't know if everyone on the street is vaccinated. I don't quite know that yet, you know?
It's so
And
crowded. Yeah.
I think going forward, just exercising caution in terms of having a good kind of like good standard of like self sanitation and whatever. Like if you go anywhere, like make sure you bring hand sanitizer with you, or make sure you do continue to wear masks, especially indoors, because I think like a lot of these things, like someone was asking how do I feel about like opening back up and stuff. I think like vaccination is definitely going to help protect us, but we're not at herd immunity. Herd
Exactly.
immunity is like 70%, 80%, and
Right.
we're just not there yet. So
No, of course.
um
Yeah.
I think it's interesting that like Como is opening back up New York City, but I'm very hesitant to blindly follow without some level of like recognition for the efforts that the vaccination crew has taken in New York City.
Yeah.
And I think that there has been some talks, like New York City does have like a vaccination passport. There's been some talks about creating that like kind of nationally. And while I think that, oh, it sounds great, it's still, I think it's still going to exclude people who really haven't had the opportunity, whether it be that they're socioeconomically underserved or they
Right.
were like later in the game, like if they're that 18-year-old who wasn't even offered until mid-April, and then they were like, oh, I couldn't even take a day off of work because I was scared I was going to get side effects or something. Then
Yes.
we're really like penalizing people who like um, want to do this. And also, I don't really feel like we should have mass gatherings just yet. But that's just me. And I'm very hesitant because I work in an ER. I see the
Of
effects.
course,
And
you see like, front row to like all these
I'm like,
cases
oh,
and stuff.
wow, we're having Governor's Ball again, which is like this huge like music festival. I'm like, okay, well, how are they going to do that? How are they going to ensure that like these teens and these like 20-year-olds and like they're all vaccinated and they all stay in their own area, you know?
Right, right. It's really hard to like, yeah, because New York City's like that. It's huge crowds everywhere you go. So I can
Yeah.
imagine. And what do you, with medicine again, what do you find the most fulfilling? You might have answered this before, but what's the most fulfilling part of practicing medicine for you personally?
I think that it's definitely just the satisfaction you get from treating patients. And also, I think we live in a culture that's very like instant gratification. And that's like how I think like a lot of people operate. And for me, like, it's so gratifying, like the simplest things. Like, I repaired someone's laceration once, and it was like right in their lip right here.
Mhm.
And they had like fallen, and it was like an employee at my own hospital, and they were crossing the street like 2 weeks later. Some random guy I've like never met. He's like, "Doctor, you're the best doctor ever." And oh my gosh, do I know this person? Like, do I just like hide in my sweatshirt and like leave? And it's because like people really appreciate like those small things you can do, like reduce their arm, like you do it like a nursemaid's elbow, which is basically like when you yank on someone's on like a 2-year-old's like arm, and it like their elbow dislocates. That's
Right.
like called a nursemaid's elbow, and essentially like you put it back, you pop it back in, and the parents are like, oh, who are you? Like those kinds of things are kind of very, very rewarding, I feel.
Exactly. You guys are essentially like the lifesavers, like in that moment where people are panicking, you're the ones who like,
In that
go
moment,
right
and
into
it's
it.
not
Yeah.
even like it's not like necessarily life or death situation. It's
Yeah,
more
yeah.
like,
It's like the thing you
oh
panic about.
wow, I feel like I made a difference today.
Yeah, of
You
course.
know.
Of course.
Yeah.
And I was gonna say with your posts, like I love that your posts are inspiring to like young women to dream big. And where do you draw or where have you drawn your biggest inspiration from growing up and stuff?
I think it's like having strong women in my life.
Mhm.
So like my grandmother and my mother, and like they've always been like, okay, like you need to like make sure like you're independent, or you're able to like function
Right, right.
without a guy, like,
Yeah,
or without like a significant other in general. I'm like,
yeah.
so I think that like the way I was raised, like it was very like, hey, like will you like go and like pursue like whatever you want, but like make sure you can stand on your own 2 feet. And that's like how I was raised in general. And my mom, like, and my grandmother, who my grandmother died when I was before I was even born. Like she kind of raised the family, and got my mother married and all this other stuff.
Oh wow. Okay.
Okay, so like, oh, like she's able to like kind of live her life as like an strong, independent woman, and I think that that's one of like the major things that I got growing up is all this
Strong woman.
positive positive feedback for being a woman, which in Desi culture is like, you're a woman, like,
Yeah.
why
I
do
know.
you want to do, you know?
Yeah.
Exactly.
There's already a lot of expectations put on South Asian women. So
Right? Like
yeah,
I mean, we have a whole conversation about this.
exactly.
But like essentially I feel like um why aren't more people like encouraging women to pursue their path, you know?
Exactly. No, that's absolutely true. And I
Yeah.
was gonna say, like you talk a lot about female empowerment on your Instagram. And
Mhm.
what are some ways that you think that young women, older women can empower themselves when they feel less than, when they do feel less
Mm,
than?
that's a really good question. Actually, so one of the things that I think like is really important about women empowerment is women supporting each other. I think like when they feel like less than, it's mainly because they're in these kind of toxic situations. A lot of the times I see this and I'm like, wait, why do you feel that way? And they're like, oh, because this person said so and so, or, you
Yeah.
know, I watched this like really silly show on Netflix. You might have watched it, like Coffee with Curran.
Oh yeah. I've seen all those
It's not,
episodes.
not Coffee with Curran. It's the love like matchmaking one where he's like,
Okay.
it's like a person, and then he's like, why can't you find a significant other?
Okay. I don't think I've seen that one, but
Oh,
I
it's
think I've heard of
actually
it. Yeah.
really good. It's like interesting, but like basically you see some of these women and basically they're like, oh, my ex told me that I'm dumb, and I'm like so like, and I'm just so dumb, and I'm like, you can't like you can't make your judgment of yourself based on what others tell you. I think like, and that's what I think a lot of the self-perception kind of like revolves around. And I think self-perception plays such an important part about women, about female empowerment too, because self-perception, toxic relationships, like basically are things that I think we can eliminate. Like
Yeah.
we can have positive self-perception, and we can just eliminate those toxic relationships in our lives to kind of make sure that we're always good vibes, good tribe, good,
Right.
and like moving forward. And I think that that's really, really important.
Like, do you think with South Asian women, it's becoming better in that sense? So we're becoming more supportive of each other? Or how do you look at it? Um,
I feel like, I mean, even if you look at like, the way women in like movies, if you go back and look at like movies like Kabhi Khushi Kabhie Gham, right? Like
yeah,
people are like, oh, that's my guy, or and now it's like, oh, like women banded together are stronger than like us fighting against each other for like dumb stuff. Like
yeah, the love triangle and all this stuff. Yeah, you're
yeah,
right. Yeah,
I think like it's kind of cool. Like it's interesting how they perceive or how they portray female relationships in movies and in like social media and like everywhere, and how that's changed in the last like 10 to 15 years itself. It's like now it's like, oh, girl bosses, like
yeah,
Ocean, um what was it, Ocean's 8, I think, like, oh, like we're together, like we're the women running the show.
yeah. Like they have centric roles. So I was gonna say, like 20. You're right. 20 years ago, it was all about just a particular role that women played, you know, and what their duties were, and now it's, you're right, it's broadening a lot. So yeah,
Yeah, I think it's so great that like people growing up can see that too. Like, hey,
exactly.
like women can do all this other stuff too. Like, it,
Right, right.
the female like lead in these like movies, or they can be like that, go-to person. And I don't like, it's not always about the guy.
Exactly. That's true. And one my last question I want to close with is going back to medicine for a second. What are some things you learned about life in general, having been a frontline worker in the pandemic, like from last year to now, even? Because I
Mm,
can imagine you're still.
on here. I think like I've been one of those people, something like basically during high school. Um, I used to be like a very like, oh my God, I need to get like straight A's. I need to do this and like whatever. And then like something happened where I was just like, I don't feel it. It's just not worth it to like study or like do whatever. And I like really like started focusing on like wellness and happiness more.
Right.
And like even as like a high school student, I used to like go to the gym all the time. Like
Yeah.
you would be like, okay, I'm like done at one. Other people are there for their sixth period, like, super hard class. And I'm like, you cannot make me take anymore. Like, I'm done. And then in college, like, I think like the stuff that I was interested in, I was always interested in like health and wellness and like well-being, because I think like that honestly has made me who I am. So as someone who's like always kind of taken advantage of all that, and even in residency, like if I had a weekend off, I'd be like wherever, like before the pandemic, and I had a lot planned. Even when the pandemic started, like I was going to do an international rotation. I was
Oh
like
wow.
gonna like travel like to like different countries that I hadn't been to. So something that I've like kind of I feel like was so important for me was like having those moments where I was like, well, at least I got to do all this before the pandemic hit. And I was so lucky to have a good support system. Where I end up is so important, whether like that work in medicine or work not in medicine. And people don't understand, like I lived alone, and essentially like the only people, if I saw like someone in person, would be the people that I work with at work.
Of course, yeah. Imagine.
Like social activity. It was like, oh, weird. I get to like talk to people in person.
Yeah,
Like, because during the pandemic, you like stop like doing anything. Like, and
exactly. Everything was shut down, and of course, your schedule must have been insane, I imagine, in the beginning.
it was very, very different because we had to staff the intensive care kind of
Yeah.
unit. Because the emergency physicians are very versatile in our skills, and so we're able to like treat like really, really sick patients. Like we're able to manage ICU level patients for periods of hours.
Right. Right.
So like a lot of the early pandemic, I didn't know what was going on. I was so sick, and like, well, we can do this procedure. Like we could put a tube in people's throats. Like that's what we do for a living.
Yeah. Yeah.
So if they're going to decompensate, you want them to be in an ICU or you want them to be in an ER. Like that's just how like it is. So things that I've learned. So there was this one picture from the pandemic where I had a nurse male nurse, and he was wearing like a bunny suit. And it's basically like you see those people in the news, they're wearing that whole body like PPE,
Right.
mask and everything.
Yeah.
And I don't know what, like, our community was thinking, but we had some very kind people from the community donate flowers to our ED.
Oh, wow.
And then he goes to smell the flowers, but he's wearing 2 masks and a huge bunny suit and protection. So it's like, I think that moment makes you realize, like, wake up and smell the roses. Like,
Literally,
can't,
right?
we
Yeah.
can't. Like, even if we wanted to, we couldn't, like, because it's dangerous. You can't take off
Right.
the mask in the ED and all this other stuff. And I think, like, that moment was just like, okay, like, that's basically, that's what you learn about life, is you just have to enjoy the times that you can and live in the times when you can, And also, I think another thing is, like, not everyone will be as considerate as you are.
Of course, yeah.
Yeah, and
I think the whole thing just turned the world upside down, and everyone's just trying to adjust.
and I think a lot of people are experiencing pandemic fatigue. And listen, like, even now, like, I'm like, hey, listen, like, I'm not gonna not, like, you can go visit your 95-year-old dying, family member in so and so part of the world, but honestly, you just have to weigh the consequences of possibly not coming back if you,
Yeah, that's
if
the thing,
travel,
right?
or if you didn't get the vaccine, then, like, you shouldn't really be traveling.
Yeah,
Even if
of course.
vaccine, like I said, exercise caution. So I think, like, really, like, using your good judgment. And a lot of people, like, just even if you watch people's stories and they're posting about COVID and good information, just make sure you save that so that you know what to do if you're not well versed in it.
Exactly.
Yeah.
Well, Siri, thank you so much for your time. I enjoyed hearing about your journey and what you do, and I wanted to personally thank you for your service, because I can't imagine how crazy, like you're already ER physician. It's already crazy enough, but you do a lot for our community, so that's really great to hear.
So much for having me.
Of course.
I like really wanted to talk with this community specifically because it's where I come from, right?
Yeah, no, of course. And I hope we can interview you again, and we wish you like the best on your future endeavors.
Thank you so much. Thanks for having me. Really enjoyed being on here, and hope that you guys got something good out of it.
Of course, yeah. Okay. Well, have a great day.
Have a great one. Take care.
Okay. Bye.